Welcome to OAC Health Talks. I'm Joe Naglowski, OAC President and CEO, and we are excited for you to join us for this educational video series that dives deeper into specific health topics that we know are important to you and the OAC community. Today's OAC Health Talk tackles another important and timely topic: find a program that works for you, setting yourself up for 2022, presented by obesity medicine physician, Dr. Holly Lofton. Dr. Lofton is a clinical associate professor of medicine and surgery at NYU Langone Health and is a past board member and longtime supporter of OAC. With the holidays behind us, many of us are ready to focus on our nutrition and health goals. However, we know there are many messages sent with different options and approaches, and it can be tough to know which plan is right for you. Dr. Lofton is here today to help you figure out what you need to look for in a health plan or treatment option so you can pick the one that best fits your lifestyle and health goals. And with that, take it away, Dr. Lofton.
Hi, I'm Holly Lofton. I'm here today to let you know you are not alone if you're looking for a program that can help you with your weight loss goals. More than 70% of United States adults are overweight or are living with obesity. But before you embark upon considering a program, you may ponder if the program is safe and if it will work for you. So I want to talk about some options of different types of programs that may be beneficial for you as you go in the next step of your weight loss journey. Some options to consider are community-based behavioral programs. These may be support groups, which are offered in churches, community centers, or even online, that provide behavioral support. Now, behavioral support encompasses not only how to change behaviors related to weight, but it also includes nutrition, activity as a type of behavior, and other skills such as logging and maintaining mindful eating. So when you think about community-based behavioral programs, this isn't just about behavior. They can also offer diet, exercise support as well. You may also be interested in an individual behavior program that can be offered in person or online. Some of these may be in the forms of apps or websites or even one-on-one sessions that can offer similar recommendations for nutrition, behavior modification, and activity. Keep in mind that any of these options I mentioned today can be used in conjunction. They're not mutually exclusive. Other programs for weight management can be medically focused. These may involve getting labs done, having a physical examination, collaborating with other medical providers to find the best plan for you. The type of options could include the aforementioned diet, exercise, and behavior modification, but may also include certain treatments, which I'll talk about in a few more minutes. Medically focused programs may offer a plethora of support options, including behavioral specialists, registered dietitians, or health coaches. They could offer doctors, such as myself, who have special training in treating obesity in the same manner that a cardiologist has additional schooling to learn about treating heart conditions. This may be a type of program for you if you feel that there may be medical conditions you're looking to treat by losing weight, or if you feel you have a complex medical history and you want some guidance in making sure the treatment plans are safe for you and will be effective for you. Other programs may be surgically focused, but surgically focused programs not only provide medical support, but specialize in preparing patients for bariatric or metabolic surgery. Of course, surgeons who have specialties perform the surgeries, and also they specialize in managing weight loss after the surgery and the complex nutritional needs of a post-surgical patient. Both of these types of programs involve a consultation with the medical provider to see what will be the most safe and effective treatment program for you as an individual. And lastly, there are comprehensive weight management programs or weight control programs. And these offer a plethora, again, of options, anything from community-based to individual programs to medicine and surgery. These are often held at universities or large hospitals that can be found in your local arena. So as you go on to think about which type of program might be best for you, I encourage you to be introspective. Really think about what your goals are and why you're looking to lose weight at this time. Keeping in mind that may change over time. One's goals for losing weight may be different at age 20 than they are at age 50. So it's a good idea to jot down not only how much weight you want to lose, but what you want to get out of that weight loss. And the way I think about this is this: if you could magically snap your fingers and be the weight that you desire, what else would you hope to achieve from that? Some of my patients tell me I would have an easier time getting around, I could reduce the medications I'm taking, perhaps increase the longevity of my life. So you really want to think about your personal goals and motivations in losing weight as you pursue a program to help you out. And when you are introspective and make these journal logs of what you want to get out of weight loss, it's important to go back to those writings when you may be at a time when you're at a plateau or even gaining weight or lacking the motivation, to remind yourself of why you started this program in the first place. I really find this is beneficial for many of my patients, and I'll move on to talk about how you might go about deciding which of the aforementioned programs might be best for you. Ask yourself, do you prefer to work one-on-one with an individual, or do you thrive more in a group setting? Some people may have a mix of both. Some programs offer weekly support groups and monthly individual visits. So ask the program what types of interactions are available. You also want to ask yourself if you feel you have special medical conditions or differences in abilities for which you may require a specialized approach. And if you do, it's important to vet these resources and determine if they can meet your needs. You may want to call up the director, manager of any of these programs and see what they may have to offer someone who's in your position. Many patients want a support system after they've had bariatric surgery, or are considering bariatric surgery and want a program that does support bariatric surgery, even if that particular program is not offering the bariatric surgery. So if this is something that you've had before or are thinking about, but you decide you want to start with the community-based program, it's important to know if this program is in line with your goals of possibly having bariatric surgery, so that you can have a supportive environment when you make decisions, both in the near future and in the distant future. Another thing to think about will be the methods of communication that the program offers. There could be in-person communication, virtual communication through a computer or app program. There could be messaging through text messages or a chat, and it could be a mix of all of these. Think about what you feel most comfortable with and what would work well for you based on your schedule, your comfort with technology, and also your geographic location. And it's very important to vet your resource. And I know many of us go online and use search engines to see what the resource website looks like or what it has to say about itself. But when at all possible, I highly recommend seeing if you can contact someone who has utilized that resource to get their honest opinion about their interaction with the program, their outcomes. Keeping in mind, weight outcomes vary amongst individuals. So just because someone did very well with their program and their outcomes does not mean that's the best one for you. It's more important to make sure that the program meets your goals, expectations, and fits with your personality. So in vetting a resource, reading testimonials is okay, but try to talk to others who are the same program, hear their honest experiences, and decide if you feel these will be pros or cons for you as an individual. I have found that patients who are interested in weight management really thrive in an inclusive and non-punitive environment. And by that, I mean You don't want a program that will punish you for gaining weight. Our weight is not completely under our control. And we know that there are sometimes we can follow the instructions to a T, follow the diet and exercise, but not get the expected results. I want to let you know that our bodies are not as simple as calories in, calories out. We do not run off mathematic equations, but we are complex beings. So it is really not acceptable for a program to punish one or withdraw something that's benefiting others if someone's not meeting the weight goals. I would recommend also vetting what the resource does in the event that the program is not working as well as you would expect, and to ask for some examples of what has been done with others if weight gain occurs in someone who is trying their best. An inclusive environment that is supportive is best. Now, some programs, especially those that are medically or surgically based, offer treatments. And while I won't get into all the specifics of treatments, you want to be sure that treatments are safe and proven to be effective. And by that, I mean certain questions should be asked about treatments that are offered. Questions I recommend would be, has this treatment been approved by the FDA? The reason I feel this is very important is because the FDA is there to regulate treatments for weight loss. And there are other regulatory divisions that are regulating procedures for weight loss. And the reason this is so important is there's research done in a controlled manner to determine if the treatment or procedure is better than doing nothing. The next question I ask about any type of treatment is, what are the risks and what are the benefits? I'll be aware of any response that says this has no potential side effects. Now, even if I take a very large vitamin, there's a potential I could feel a little lump in my throat because the vitamin is large. So if there's a treatment that involves an injection, there's a risk that the injection could cause me some distress for a short amount of time. So to say there is no potential risk for any treatment is usually a stretch of the imagination. Now, the goal is not to say there's no risk, but to say that the benefits of the treatment are greater than the risk. And anyone in the program who's offering these treatment options, whether it be a health coach, a dietitian, a physician, should be able to have a sound conversation with you about what the benefits are and what the risk would be to you as an individual. So make sure to ask these questions. Again, has this treatment been FDA approved? Is there another regulatory board that has vetted this treatment to make sure it is safe and more effective than taking nothing or doing nothing? And then what are the expected benefits to me as an individual? Other things to consider would be the mode of weight loss. So would you prefer a program that involves regular grocery food meals where you go to the store and you buy your foods and you prepare your foods, or if someone else is making them or you're using a food delivery service? Other options will be programs that offer meal replacements such as protein shakes or bars or different types of snacks. Some offer a combination of both. Some programs may offer cooking classes or recipes to help you along the way. So it's important to ask what type of support in the nutritional realm is offered at various programs. And can that be adjusted to fit your needs? So if you're not really finding yourself to be a great cook, but you want to be a cook, maybe something that offers cooking classes and recipes, or if you're absolutely not interested in learning how to prepare your own meals, something with meal replacements might be better for you. And also the flexibility of the program. If I decide that, in the summer I'm going to have a different environment than in the winter, will my program be able to shift as my needs change? This is important because as humans, we don't follow the exact same patterns all the time. And those who are offering the program should be able to be flexible with you. Now, I've spoken about some different types of programs, some questions to ask, how to vet a resource, but I do want to offer some insight into some things you should be wary of. There are many resources that may be out for causes that are not necessarily your health and well-being. So some of the signs I would look out for with a program that might make you think a second time about pursuing these programs would be those that have one specific diet for all. This is important because we know that obesity and overweight are heterogeneous conditions. This means that if I put 100 people in a room and offer them the exact same diet to eat for 30 days, and they all follow it exactly, and they all have the same activity exactly, when I bring them back in 30 days, we'll have 30 different results. So one cannot expect that one plan exactly eating the same thing all the time will work the same way for everyone. There should be some flexibility and allowance to adjust that plan to suit the individual and offer additional support when needed. So be wary of one specific diet plan for all. Something else to be aware of is the individual who's providing the nutritional support, the activity support. It's important that they have experience treating a few different types of people. And I would be concerned if a health coach or someone who's offering the total plan only has the experience of their own weight loss. While it's very commendable to lose weight, to do the journey of really tracking and eating well and exercising, we can't expect that everyone will have the same results because, as I discussed, this is a heterogeneous condition. So it's important that this person has dealt with those who have results the way they did, but didn't have the results the way they did, so that that plan can be altered to suit the individual. So you want to ask about the education and the training of the individual who is offering the program, especially with regards to the diet and exercise aspects of it. Next, I would be concerned if a program does not offer a maintenance plan. We know that weight loss has a beginning. There's a day one. There's a middle when we're losing weight, but it doesn't necessarily have an end. A program that says is 30 days or 8 weeks with no plan to maintain weight after that is likely to leave you hanging with possibly a good weight loss, but no plan to keep that weight off. And we know that weight regain is not only physiologic, meaning it happens because our bodies have a desire to regain weight, but also it's really frustrating. So when one loses weight, if we don't have a plan for keeping the weight off, we can expect weight regain. So I think it's important to ask, what's the plan for maintenance when I finish the weight loss phase of this program? I see patients for weight management, and I continue to see some of the patients I saw on the very first day after being in my position for 10 years. So we know that this struggle goes on for a long time, and you may wax and wane in your weight, and you may change the things that you do to lose weight or keep the weight off. But that maintenance is ideally where you want to be for the rest of your life. So it's important that we have a maintenance plan that will allow us to keep weight off and also have a plan for if weight regain occurs. There are some programs which tend to offer what I call a deserted island environment. And this can be a little concerning because in these programs, they essentially take a group of people and carry them off to a deserted island, and they offer them chef-prepared meals and exercise maybe for many hours a day and control what they eat, their activity, where they live, and also teach some things that can be helpful with weight loss. But with these plans, we always have to go back to reality. So if you want to do something like a camp, a cruise, or any type of off-site environment for weight loss, it's very important that, again, these programs have a plan for weight maintenance and how you will transition this into your normal life. And finally, I would be wary of any plan that offers weight loss without diet or exercise. While we know that obesity and overweight are complex conditions, we do need to make behavioral, nutritional, activity changes in order to see long-term results. And again, they may offer treatments which may not be vetted. So as I said, you want to have the vetted treatments, and it should really make sense as to what the plan is, that it will involve some type of effort in order to be beneficial long-term for healthy weight loss and weight maintenance. So I also offer you to look at some resources that the OAC has made available on its resource library, which is fairly new. You can find it at obesityaction.org/library, and there are many resources which can help you not only start your journey, prepare for finding a program, but maybe even help you find the program that works for you. I thank you so much for your time, and I wish you well in 2022 and beyond. Thank you.
Thank you, Dr. Lofton, for providing us with such helpful information as we navigate the different plans and treatment options that are available to us. We hope each of you are now ready to take the next step in finding the treatment or health plan that works for you. The OAC has a variety of educational opportunities for you throughout the year, but one of the best places you can turn to for quality, unbiased education is our resource library. Simply visit obesityaction.org/library and check out our brochures, articles, guides, videos, and more health talks just like this one. Also be sure to subscribe to our YouTube channel to get notified of any future educational events and broadcasts. Thank you for joining us.